Hesselgesser On Purpose was brought to you by the Farmhouse Cafe, farm fresh foods you love to eat. If God Could Bake, where they deliver home-baked happiness right to your door. Alston Computer Services, professional computer service at an affordable price.
Living in the millennium, souls be looking for a healing, and he's healing them, filling some of them with his spirit.
My name is Robin Hesselgesser, and this is Hesselgesser On Purpose. Tonight's show is for anybody who believes that your back is aging faster than the rest of you. When we come back to the show, I'll introduce Dr. Drew Drummond, who will alleviate neck and back pain from your life. But first, take a look at this.
The process of upper cervical care really revolves around adjusting the top bone of the neck in a much more precise way than anybody else does. And in order to do that, we have to take x-rays. So we take a three-dimensional view of everybody's neck, one from the front, one from the side, and one from the top. And then we analyze it to determine mathematically what we have to do to put the atlas back in place. Yeah, so basically there's three views, one from the side, and then this X-ray tells us how to take a picture back down through the top of through the front, and then this is the front view of the atlas, and then this is the top view. And we're able to find out exactly how that bone is misaligned, and then everybody's misalignment is just a little bit different. Nobody's the same. Mm-hmm. So we mathematically calculate what each person needs, and then we adjust them.
Welcome back to Hesselgesser On Purpose. Dr. Drew Drummond, thank you for being here today. We just saw some of the footage yesterday when we were at the Spinal Health Balance Center. Spinal Balance Health Center. I always want to invert the two, I don't know why. What amazing experience. Number one, you have a lovely facility. I was most impressed from the moment I walked in. It just felt warm and inviting and just warm.
I can't take credit for all of it. I had help.
You did?
Yeah.
From a woman, I assume?
Yeah, well, yeah. Several women.
Maybe, okay. As it should be. Yeah. So thank you again for letting us. And it was a delight to see exactly what you do and have one of your patients. And I tell you what, I don't know if you paid him, but he is he's quite the spokesperson for you. He's a living testament.
It's fun to hear him talk about what we do because I don't always get that perspective.
Of course.
They're in and they're out. Yeah. But then to actually hear them giving feedback like that, it's fun to hear. Yeah.
Well, I think sometimes too we take what we do for granted and we get kind of that industrial blindness and we don't always know from a patient's perspective how you've changed his life. I mean, you have truly changed his life. Yeah. So let's start educating our audience.
Great.
Your facility, Spinal Balance Health Center, has been in existence not that long.
Not in that building. We moved into the new building in July. I started it in 2006.
Okay.
In a very small 730 square foot office, just my 4 waiting room, chairs, and my adjusting room. It started out very small.
Now you specialize in a somewhat new and innovative type of treatment called NUCA. Is that?
Yeah, I wouldn't call it new. Certainly, it's kind of cutting edge, but it really started in the 1940s.
Really?
It's been around for a while, but it's not practiced by very many doctors for a number of reasons. One, it's just very difficult to do, but it's a unique technique that's only practiced by about 200 or 300 people in the world.
So what is NUCA?
It's an acronym. It's a chiropractic technique. It's an upper cervical chiropractic technique, and NUCA stands for the National Upper Cervical Chiropractic Association. But what it is, it's a very specific way of analyzing and adjusting the very top bone of the neck in order to relieve pressure, relieve interference to the nervous system, allowing our bodies to function better.
So one of the things that you taught me yesterday was that what I like about what you do is that it seems very natural. You seem to have the insight to let the body, you know?
I don't know where our healthcare system went awry, but somewhere along the line, we've turned to symptomatic care to where people go to their doctors with a symptom, and then there's a specific or treatment, a lot of times a drug or a surgery or some external therapy to try and make that symptom go away. But in reality, what is oftentimes best is to treat the body and simply get the body functioning the way it's supposed to be in the first place, and let our own body's natural healing and maintenance mechanisms take over. And that's where NUCA has a little bit of an edge on some other types of therapy, is that we're just simply reinstating the way the body is supposed to work. And when you can do that, you can do amazing things with people's health.
So walk me through, as we did the other day in your practice.
Okay.
So the first thing that you do with someone is a consultation.
Initially I will just sit down with the person across the table and I'll visit with them about what's going on, the things that they're wanting help with, trying to hone in on whether it's something I believe should even be in our clinic, that things I can help with. And then after I get a feeling for what's going wrong with them, we take them and we do a very, very specific upper cervical exam where I look to see if their posture is indicating a problem at the top of their neck. And it's a very important step of the process, because when a person's atlas, which is the top bone of the neck, when it's out of place, it will start interfering with a lot of different nerve functions in the spinal cord and the brainstem, but some of those functions control posture. So I can just look at a person in an exam, and what I will see is that their shoulders are uneven, or their hips are uneven, or they might have one leg that is shorter than the other. And it's usually because of an atlas issue that's causing interference to the nerves that control the posture muscles of the back.
So when we talk about that, I'm curious, what does your field say about being born that way versus, an event? Or, speak to that a little bit.
Well, like specifically,
none of us are perfectly.
Yeah, no, everybody has some asymmetries.
Except for me. I'm pretty,
and me. But aside from us, there are normal asymmetries in the body, and we know those, to be there. But for example, with a leg length difference, when I look at a leg length difference to see if a leg is short, 90% of the time that short leg is because muscles of the back are not balanced properly and they're not pulling evenly on the framework. About 2% of the time, it's actually bones that are different lengths. So while that can happen, and a lot of people think they have a short leg because they think of it as a bone issue, it really isn't. It's a posture issue that really goes back to nervous system problems. And that's why we have such a high level of success evening people's structure back out, is because a lot of the asymmetries aren't because you're born that way, or aren't significant enough to cause the types of posture problems that we see with people, but really they're due with your nervous system not functioning the way it should, then pulling your body out of line.
And we've learned to compensate.
Yeah, it's what leads into most people's back pain and neck pain. In fact, the two biggest problems that would come into my office would be neck pain and back pain. And the reason is because when the atlas is out of place and it interferes with the nerves that control posture, it causes one side of the back to tighten more than the other side. And since the muscles attach up at the shoulder and down on the hip, when they contract, they give the body almost an accordion type effect that then gives them what's called a physiological short leg. And when you stand on a short leg your whole life and have to compensate for that, there are certain areas of the spine that are very common to people to wear out faster than they should. And it's the low back and the neck for most people. And it's where most surgeries happen. If you ever talk to somebody that has a spinal fusion, it's almost always C5, C6, or L4, L5, L5S1, because those are the areas that would compensate for the imbalance itself.
What is your particular view on back surgery?
I think that back surgery is necessary for people that just confine it to degenerative problems, because if somebody gets into a car accident and they have some kind of acute trauma, then the only way they can go is surgery. But I think that a lot of the surgeries that we see are treating the end results of a stressed posture over long periods of time. So for people to manage that problem throughout their lives, they can avoid the surgery. And I've even had people that come in when they're facing the surgery and they've been told that the drugs aren't working, the injections aren't working, and they're looking at an inevitable surgery. And then we still can straighten their body out and relieve that tension, and their body can still heal and maintain itself while not necessarily getting rid of some of the long-term degenerative changes that have taken place, which is what a surgery would fix. It turns out the surgery maybe wasn't necessary after all, and they can live with those changes. So it depends on which part of the problem you want to look for. It's a good analogy is a car that's out of alignment. If the wheels are out of alignment, the tires are going to wear out unevenly.
Of course.
And you can either just address the tire issue where they're wearing out, or you can address the alignment issue, or you can do both. And sometimes with the body, it's necessary to do both. You have to switch the tires that are wearing out, or fix the low back. But then you should also fix the alignment issue, which is what somebody like me would do, and not just stay in a crooked body and keep fixing problems.
Yeah. I feel like I really need to, kind of I'm going to start watching my posture. I was so struck by your patient story yesterday. And as we're talking, we're seeing clips of what went on. But I number one, I appreciate anybody's willingness to be so open, and because I really feel ultimately he wants to help other people. He wants to let people know that if you're suffering, you don't have to. That you can come see you, and that there are options, without surgery. Not that you can help everybody, but I mean, he was emotionally in a place where he was considering, there was so much pain and there was so much anguish and anxiety that maybe it wasn't worth it.
Yeah.
What was happening to my right neck, the right side of my neck, my right shoulder, my hip, my right ribs, my right knee, my right ankle, literally the right side of my body was falling apart. I was diagnosed with trigeminal neuralgia, which is considered a suicide disease. I was distraught because the doctors told me I had trigeminal neuralgia. I went for an MRI, all the scans. They were looking for the trigeminal nerve in my brain. They were talking about brain surgery possibly. I thought my life was over because the trigeminal neuralgia is so painful that people kill themselves. It was tough. It was really tough, and I will jump way ahead. This technique or the practice that Dr. Drummond does is so simple, but it's so effective. I don't even think about that stuff anymore. I mean, I thought my life was over 4 months ago, and now, I don't even think about it. I'm totally pain-free.
It's patients like that drive my practice. I've got like an army of patients out there that are just like Jeff, that are so willing to share this with people because they know that it took them so long to get to a place that actually started fixing underlying problems and getting their body healing, that they want other people to have that. And it's amazing to see how people are willing to share this with others. There's a few things that really surprised me after I started this practice, but that's probably one of them, of how willing other people are to give their friends and their family advice and try and help them to the right spot.
One of the things that that struck me is just, I mean, he was so serious, but I couldn't help but laugh because when you did the first treatment, he said, "I want my money back," because he expected something else. He expected cracking and popping and maybe bunches of people coming in and doing things and holding his feet. I don't know what he expected, but
it certainly wasn't what we did.
No, and one of the things that you really spoke a lot about is that it's very gentle.
Yeah.
That it doesn't take a lot, which makes perfect sense to me. It shouldn't. It shouldn't be painful.
And one of the reasons people are left maybe a little short with the adjustment, and they think, God, are you doing anything, is because there's such a build-up to the point where we're actually ready to do the adjustment. We bring them in, we have a consultation, we have an exam. After that, we take them in, we take x-rays of the top of their neck, and then it takes enough time to analyze that I can't really adjust them that first day they're in my office, so we send them away, and they come back, and I show them their films, and the misalignment is, that atlas can be maybe 2 millimeters out of place and cause all the health problems that Jeff had. And then when I show them their problem, I lie them down, and it's just such a gentle adjustment. It's just it's kind of building up to this climax, and then it's just not there. But then after the adjustment and the nervous system starts functioning better, that's the bang.
So explain how the nervous system really works in tandem with what you do.
Okay, well, it's all about the nervous system, and most good chiropractors would tell you it's all about the nervous system. But your brain is generating all of the nerve impulses that coordinate, your brain and brainstem that coordinate the rest of your body function. And you're sending trillions of nerve impulses down through your spinal cord, through your brainstem, your spinal cord, and then out to your body. And then vice versa. Your body sends information back up to your brain. And it's this very dynamic cascade of information that's controlling the way your muscles function, the way you digest food, the way you excrete food, the way your hormones are released out of glands. Every single function you have depends on this nervous system doing what it's supposed to. But when the atlas is out of place, even just a couple millimeters, it starts interfering with the nerve transmission through the top of your spinal cord. So you end up having a breakdown in communication between your brain and your body. And we've talked about posture already, because these same nerves are the ones that control your back muscles that should be pulling you into an upright posture. But it also, we see people with digestive problems, with chronic headaches, with, you could just go, fibromyalgia. Thank you for giving me the word.
I knew it.
Trigeminal
that's amazing
neuralgia,
to
all
me.
these things. Yeah, and we deal with them symptomatically so much. We've gotten into a place in healthcare where if somebody has a pain, we just start looking closer and closer and closer at the area. And eventually you lose sight of the big problem, which is this person is just simply out of balance and their nervous system isn't functioning right. So this adjustment simply is a very accurate way of analyzing a person's bone at the top of their neck, mathematically calculating for them what to do with it, and then relieving that the interference to the nervous system, and then just allowing their body to start functioning properly. And then the nervous system truly does most of the work. All those things that Jeff was talking about happened to him, I played, really a very small role in that. I found out how the bone was out of place.
Modest.
Well, it really is. I think that if I start taking credit for the way the body functions, I'll get struck by lightning when I walk out of my office sometime, but that really is it. It's just, it's an amazing body that we have.
Yeah.
And if people would just find out what's wrong with it and get it functioning better, they'd be far better off than taking a medication or something that's temporary. And I don't know of another treatment that has more of an impact than what this does.
I'm just fascinated by, I love your philosophy too, because we've become such a society of you're right, let's look at things under a microscope instead of taking a global view of what's going on. And while we're doing that, let's take a pill. So talk to me a little bit about how your technique and your philosophical approach relates to the direction that healthcare is going right now.
Everything in healthcare is directed towards symptoms. Most insurance companies want to know that there's a symptom, they want to know that there's a pain, they want to know what you're fixing, and they want the treatment to match up with that symptom. And if they're going to reimburse, there's all these things that have to fall into line. And what we need to be focusing on is getting the body functioning better. And we need to do it before the symptoms ever start. So in reality, if we were going to have an ideal healthcare system, we would have things in place to keep people healthy, rather than finding the symptoms show up and then coding it correctly, sending it to the insurance company, seeing if they're paying for it, and then treat it, but instead keep people healthy. And when people come in for, like, say, a digestive issue, I've adjusted people and taken care of several of them. But that's not really accepted medical treatment or healthcare treatment for a digestive issue, is getting the nervous system functioning better. So so there are a lot of problems with what we've got going. I don't see it changing anytime soon, so it really puts the onus back on the person. The people have to decide, what kind of healthcare do you want? Do you want your body to deteriorate over time and not maintain it? Or do you want to be healthy when you get older and not have to rely on that more invasive healthcare system that we've got? And even when the symptoms arise when you're older, it's never too late. You decide where you want to go. Most of the people that end up in my office have gone that direction. Very few people end up in my office first. And it says something about the way we treat our bodies and the type of doctors that we go to. And it's failure after failure after failure that finally brings them to me. But it would be better if it was the other way around.
Yeah, absolutely. Well, and I feel like we've kind of conditioned ourselves that as we get older, we're supposed to have aches and pains. That's just the natural progression. We're supposed to feel badly and just accept that. And I think what you're saying is no. We're born. I tell people, I have a patient orientation class, and one of the principles to what we do is that good health is our birthright. We are supposed to be healthy, and intuitively we should know this. I'm happy.
Yeah, but you could take two healthy babies, put them side by side, give them to a pediatrician, and say, okay, one of these babies eventually will become 80 years old and terribly sick, and the other one will still be playing golf. right? And they wouldn't be able to know which is which, because at that age there's no problem. It's not genetics, it's not disease that causes people to become ill. It's a lot of lifestyle things, and it's having little issues like this that cause their nervous system not to function properly. It seems like everybody comes to a chiropractor because they want relief with neck pain, back pain, headaches, or some kind of weight-bearing joint issue. And that's, in reality, most of the people that get to me, that's why they come, because we just hit home runs with that kind of stuff. And then once we adjust them and straighten out their body, then they see all these other amazing things that happen. I've had changes with people's hearing, their vision, difficulty swallowing. Acid reflux is huge. I don't have a statistic on this.
You know,
so
I'm having problems with my boyfriend. I'm going to come to. I'm going to come to your.
I'm not kidding.
office.
As I have a new patient, one of the things that I do is I push on the spine and I go right down the spine and I look for tender spots. And if the spine is tender, it's usually an indicator that those vertebrae are out of place. And when I get down to about the fifth to seventh thoracic vertebrae, if it is tender and indicates that bone is out of place, I will say to them, "Do you have acid reflux?" More than half of the time they'll say yes.
Really?
And more than half of the time when I adjust their atlas, straighten their posture out, the acid reflux goes away. And some of them have been on a Prilosec taking some kind of a drug for years, if not decades.
Yeah.
And it goes away as soon as we straighten the body up, because it wasn't an issue with their stomach, it was an issue with the nervous system. Yeah.
Wow.
So then going down, IBS, constipation, diarrhea, numb tingly sensations in the limbs. I had a gentleman that came in that lives in Gretna. He had a burning sensation in his leg that he really didn't think he'd be able to live with much longer. We adjusted him, and over about, probably a 2 to 3 week period, it went away. Just because his body was regulating itself more properly. Plantar fasciitis, knee problems, hip problems. I could go on. Trigeminal neuralgia. I just started a trigeminal neuralgia patient.
What is that?
The trigeminal nerve is the one that feeds your teeth, and it's known as the suicide disease. I think Jeff might have even talked about it a little bit in the video.
Yeah, he did. And even then I said, what is that?
Yeah, and it's one of the gentlemen that I've talked to that had it, he described it as the nerve sensation when you bite on a piece of tin foil on a filling, except to all of your teeth all of the time.
Oh.
Yeah, so anyway, and that's why they call it the suicide disease, because people just can't live with that kind of pain. And I started a gentleman the other day, and even in my office, he had several of these trigeminal neuralgia symptoms, and we adjusted him one time. He came back 3 days later, and he was already seeing relief from the trigeminal neuralgia. But everybody else that had looked at him, the neurologists are looking at the trigeminal nerve. They look at dental issues. They just focus in so much on that area, like we're saying. They didn't just take a step back and say, hey, let's balance this guy's body out. Let's get his nervous system functioning better.
So I want to know a little bit about you.
Okay.
Because obviously
I'm better at talking about upper care.
That's okay. It's not scary, I promise.
Yeah.
But I want to know what in you went this direction. So I'm always curious because you're highly successful. I see the passion in what you do. I obviously see the results. So I want to know what in you got to this point.
It's about a 15-year journey that got me here, but it started in Columbus, Nebraska, where I was a high school guidance counselor. And
Really?
And I was taking these kids to computer labs and different places with their own career searches, and they were coming out with these incredible careers that they were doing, and I found myself not enjoying mine as much as I could see that they were going to enjoy theirs, and I thought, well, why it's not too late for me to stop or start something else. So I knew I wanted to be in the healthcare field, and I looked at a lot of different careers, and my wife suggested that I be a chiropractor.
It's always because of a woman.
Yeah.
Men are always where they should be because of a woman. Good, Andrea. I love it.
Yeah, I'd never been to a chiropractor before. In fact, I said, honey, I've never even been to a chiropractor. My grandmother went to one. I have no idea what they even do. And she goes, oh, just go see mine. So there's a chiropractor in Columbus, and I called him up and I said, hey, Dr. Rickard, this is Drew Drummond. I'm Andrea's husband, and I'm thinking about going to chiropractic school. Can I come in and get adjusted and see what it's like? And that was how it all started. I went in and talked to him, and then
right?
and then I ended up at a fantastic chiropractic school called Palmer College of Chiropractic in Iowa. And there's a lot of different directions that you can go with chiropractic. And choosing NUCA is a unique choice for people. It's usually more of a full spine adjusting technique because people they've come to chiropractic school with an idea of what chiropractic should be because somebody helped them. And then they get there and they follow that path. And I got there with this clean slate. I didn't have any idea what I was doing. In fact, the first day I sat in this philosophy class with some really heavy hitters in the chiropractic philosophy world that was teaching it, and they were talking about this stuff like chiropractic care getting rid of headaches and high blood pressure and diabetes and all these things that I now see go away in my office. And I thought they were crazy. I really was looking for a way out, but I had sunk so much into going to chiropractic school I had to go. So, but I just soaked it all up, and there were these miracle stories that people would, that other chiropractors would bring and talk to the students about. And whenever there was a case, it was, somebody went to the Mayo Clinic with some very serious problem and they couldn't figure it out, and then a chiropractor adjusted them and they got better. It was always an adjustment at the top of the neck, always, consistently. And as I heard this more and more and more, there was one group of doctors that just seemed to be rising to the top and having more of these stories than anyone else, and that's what I wanted. I wanted to be able to help people in a way that wasn't, I won't say only neck and back pain because that's such an important thing to treat, but I wanted these other amazing stories. So I went to a conference in Chicago, and we were broke at the time. We were poor college students, but we knew we had to go. And I went, and my wife and I, she went with me, and we sat in this conference with the most amazing group of doctors that I've ever encountered in my entire life. I knew, 1 or 2 days into this, seeing these people, the highest level of integrity, the most intelligent people that are looking problems in such a different way, and so absolutely committed to the patient that I knew I had to do it. There was no turning back.
Oh, that's amazing.
I had to do it.
Well, I just so appreciate you being on the show, and I really, again, want to emphasize that if you are questioning whether he can be of help, make an appointment and go in and at least have a consultation.
Yeah, it's Spinal
because you
Balance
don't
Health
have
Center.
to be in pain.
No, we can do consultations and just determine whether or not we think that you're a candidate for care. It just takes a phone call, and I would encourage anybody that thinks they've hit the end. They've really tried everything and there's no hope for them. There a lot of times there's hope.
Yeah. Oh, well, thank you so much. I'm a fan. Yeah. I'll be a patient.
Well, I'm a fan
and
of you as well.
like I said, if in fact I have if my big toe hurts, I'm going to come in and see you.
Yeah.
Thank you for joining us this evening. My name is Robin, and I am reminding you to live your life
under control, cause I'm living my life for him, giving my life for him, killing my strife for him, fighting the fight for him, not by sight or by might, but I'm a light for him, I got a light for him, keeping it tight for him, keeping it real for him, this is the deal, yo, I'm accountable for every word that I say, all the sin living within me, Lord, take it away, I love my sin, Father God, please, take it away, that's within, Father God, please, take it away, I love my hurt, Father God, please, take it away.
Hesselgesser On Purpose was brought to you by the Farmhouse Cafe, farm fresh foods you love to eat. If God Could Bake, where they deliver home-baked happiness right to your door. Alston Computer Services, professional computer service at an affordable price.